Hi, I'm Mark Roland. I'm Deputy Medical Director and Respiratory Consultant here at Portsmouth Hospitals. I was the clinical lead for our COVID vaccination hub back in December 2020 when we actually launched the hub, and we were one of the first hospitals in the country to launch the hub. We had about 2 weeks notice to pull that together, and it was an enormous team effort to actually pull it together in time. So many people from around the hospital and around the area coming together to facilitate that. We had immense pride having had a weekend of rehearsals, bringing our first patients through the door on December the 8th last year. And we literally had queues of patients and staff to come through to get their vaccines. Initially, we had to screen all of the patients medically to make sure they were safe to have the vaccine and to consent them for the vaccine. And so we had a rota of doctors, of which I was one, who were seeing all the patients before they went on to have their vaccines. Thankfully, that didn't last more than a couple of weeks, and actually the majority of vaccines delivered in the country have been delivered by nursing staff who've been able to make their own risk assessment and consent and give the vaccines. We ran our vaccine hub through from December through to I think April or May in that first iteration, and we vaccinated many thousands of staff, our own staff, and many thousands of patients as part of that programme. As a respiratory consultant, I've been able to see the benefits that have come from that vaccine programme. In that first January 2021, we were inundated with people who were very ill from COVID, people who had not yet had the opportunity to get their vaccine. But again, as a respiratory consultant looking after COVID patients, even to today, we're seeing far fewer patients, and more importantly, we're seeing far fewer people who are very ill with COVID or who have particularly severe respiratory problems associated with it. And I think that the vaccine programme has been the fundamental game changer in terms of protecting people from those severe outcomes, but also in terms of opening up our society again and letting us live the way we want to live our lives with our friends and our family members, and not having to hide away and live in fear of the consequences. So we have so much to be thankful for, I think, in terms of the vaccine programme, and my colleagues and I are very proud of the part we were able to play in delivering vaccines and supporting that programme. Obviously, we're still now having COVID boosters, particularly for those who are the most vulnerable people in our society. The risk still remains, and the science is telling us those boosters are essential to maintain a safe level of immunity. So I would strongly encourage people to continue to get boosters when necessary if you're in an at-risk group. Along with that, we're now seeing a significant resurgence in flu following the pandemic. We saw lower numbers in the peak of the COVID pandemic, but that's really picking up now, and it looks like we're going to have a difficult year associated with flu infections, particularly influenza A. The flu vaccine this year is highly protective against the two dominant strains of flu that we're actually seeing coming into the hospital. So I strongly recommend that you get your flu vaccination as well to protect you and your families this winter.